Welcome to East Meets West, an integrative approach to men's health. My name is Michael Johnson. I am an acupuncturist and co-host here, and I've been practicing for 15 years with a lot of focus on a lot of different conditions, including men's health, which is what we're here to talk about. And I want to introduce Dr. May, our expert in men's health here. Dr. May, tell them about you.
Yeah, Dr. May here. I'm a naturopathic physician, board certified in endocrinology with, again, like Mike, 15 years of experience, clinical experience. And I mostly treat hormone conditions now. So a lot of low testosterone in men. Also treat some women too, but my passion is men's health. So excited to kind of talk through cardiovascular disease today because it still is the number one killer in men. So this is a big part of men's health, especially as we get older.
So it's going to be a killer episode. That's bad.
Oh, boy.
And by the way, Dr. May talked about testosterone. If that's something you're interested in, check out our previous episodes because we have a couple on it. So,
absolutely. All right.
And Dr. May, tell us about cardiovascular disease. You said it's the number one killer.
Yeah, so based on age categories, it's either number one or number two for most men. Overall, it accounts for 24.3% of all deaths in men. Cancer's a little behind that at 21.6%. And that was based on a study published in 2021. Now, if we go by sort of age categories, once we start getting into like mid-40s in men, cancer's a little bit higher at 24.2%, heart disease at 24.0%, and that continues into 60s and 70s. Cancer is still a little bit higher than heart disease, but once you hit your 80s, now heart disease kind of takes over as number one significantly. It's 30.1% versus 14.8% in cancer. And so it's like, there's this transition here where it's still at the top of the list. It's just cancer, like mostly prostate cancer and colorectal cancer are going to be up there as far as the leading cause in those age categories.
That's really surprising to me. You mentioned like 40s into 50s because a lot of people don't think that you have to worry about anything cardiovascular if you're under the age of 60. I mean, at least in the generations I've known, it's like, okay, if you're not 60, not anything to worry about.
Yeah. They've done some interesting studies on young men who die, especially who have been like super active, they're athletes, even like into their 20s, and if they've had some alcohol use and stuff like that. Basically, what they've done is through autopsies, they can see actually early stages of cardiovascular disease already then, like in your 20s.
Wow.
And so this is a process that just doesn't happen overnight. It's going to take decades to form or to progress to a point where it's going to become a big issue, like a heart attack or stroke. And oftentimes that's going to happen in a guy, like a man's like late 40s, early 50s is if they have a heart attack, that's usually when we're going to see that first one.
Really? And that young? Wow.
Yeah. Yeah, I think the average age is somewhere like 54, 55, something like that.
Oh,
and the problem with that, though, it's a high percentage. I'm going to miss the number here because I didn't look it up beforehand, but I think it's somewhere like 40 to 50% of all first heart attacks in men are fatal. And so it results in death. And that's oftentimes the sort of first symptom that we see is a fatal heart attack. So
yeah,
this is definitely something we've got to think about being more proactive and preventative about, because oftentimes it doesn't present with a lot of symptoms prior to, being to a point where we can actually do something about it. That's not like higher interventional level.
Yeah. It's actually the same in Chinese medicine. I was doing some research, and back thousands of years ago when they were diagnosing a lot of the heart stuff, which I'll go into the terms later, they actually, the first symptoms were the exact description you would expect for a heart attack. Like that's what they described as like this pressure in the chest with pain. And like they were describing a heart attack. They just didn't have the word for it. But a lot of times that was their first symptom of like, okay, there's something wrong here.
Mm-hmm. Yeah. Wow, that's interesting. Yeah, and that's what I love about traditional medicine, especially Chinese medicine, is they were just so observant. So they, even though they don't have the same kind of vernacular terminology and understanding of it that we have today, they still were great observers. So we still like they observed those things happening and they wrote about them, and we're just now able to a little bit better understand them.
Yeah, exactly. And they actually were one of the first cultures to do autopsies as well. So
Oh, really? I didn't know that.
yeah, they did it
Huh.
thousands of years ago. They were doing
Yeah.
autopsies.
Wow, that's cool.
Yeah.
All right. Some other disheartening numbers about heart disease or coronary vascular disease. So 350,000 men die of cardiovascular disease each year. That's like 1 in 4 deaths, according to the CDC.
Oof.
And half of those men who die, like I just said earlier, so here's the percentage. I did actually write this down. Half of the men who die suddenly of coronary heart disease had no previous symptoms. And then from 2013 to 2016, it's estimated that 47% of men over the age of 35 had hypertension, which is one of the leading causes of cardiovascular disease because of the damage that it creates in their blood vessels. So that's almost half of men over the age of 35 had some level of high blood pressure. And then the other thing is too, like men develop heart disease at a more significant rate and earlier than women by as much as 10 to 15 years.
Oof.
So again, that's why we see those heart attacks and strokes earlier on than we do in women.
Do you think that's more environmental or more just genetic? Like, what do you think?
I don't know. I think it's complex. It's got a lot of variables. I think guys, while we're doing this podcast, guys, we don't take care of ourselves, very well. We're not very proactive and preventative like women. I mean, if you look at the typical patient in functional medicine or naturopathic medicine, I mean, it's vast majority are women, and they're women, starting about 35 to 40 when women start becoming very proactive about their health, up until like their 60s or 70s. Like that's the vast majority of patients in these sorts of clinics. A very small percentage are men. And that's just because we classically just don't do well with taking care of ourselves, whether that's, part of our culture of being like strong or being men. We don't ask for help. And so, we just kind of grin and bear it and just push through it. And some of these things you just can't push through.
Yeah, I would agree with that. And I have also noticed that if somebody does come to me who's a guy, a lot of times they're referred by wives, girlfriends, somebody else. And also, like, they'll downplay their problems. I see this a lot, and I guarantee it contributes to the heart issues because I asked somebody what their blood pressure was last time they got it checked. Well, it was actually pretty good for me. Well, if you ever hear those words, you already know, like, they need to do something about it. It's pretty good for me. It was, 160 over 110. It's pretty good for me. It was, fairly low. And I'm like, you really need to work on that. Oh, no, it's fine. It's like, it's right on the edge, but it's not that bad. It's like, no, it's not on the edge. Like, get this thing
yeah, you're smack dab in it. You're not on the edge.
But people don't realize, right? You just think like they check my blood pressure every time. They say it's a little high, but I'm still young. Like I'll do some natural stuff and see how it works. And by the way, I'm not insulting natural stuff, but like when you start getting into numbers that get scary and are causing major issues, like there needs to be further intervention, in my opinion. So
I do that a lot too. When guys, when blood pressure gets to a certain level consistently, then we're past that point where natural stuff is going to help. And so I see this play out a lot in my practice where I actually have to put them on a blood pressure medication for 3 to 6 months, and that buys us some time to start doing all those other things, diet and exercise and supplementation and things like that can sort of naturally bring that number down that way. And you'll see that if they're really consistent with it on the medication, those numbers will really start to drop pretty significantly and pretty fast. And then we start titrating that dose of the medication down and then eventually off and see if they're able to maintain those good numbers with all the natural stuff. And a lot of times it works great, but you're right. Like when people get up to, or guys get up to those numbers, like it's just too dangerous. You're just a walking time bomb, and you just don't know. There's just the unknown of not knowing like how progressed this is, how significant it is. Are you going to stroke out tomorrow, or is it going to be 2 to 5 or 10 years before that happens?
Yep. I mean, I remember when I was in Alaska, somebody didn't even know they had high blood pressure, said their heart was fine. They had their blood pressure checked while we were there, and it was 220 over 160.
Wow.
And it was just like, yeah, you're taking a trip to the hospital. Like, but they had a headache. That was their only symptom, is like, I got this headache. I don't really know where it's from. And then, you checked and there were no other symptoms. This has probably been going on for years and it just never got checked, and it escalated. And by the time you get to that point, there's all kinds of chances for damage. So as we usually say in this show, get your stuff checked. Like, go to the doctor, get it checked regularly. Check it at home if you need to, but just get a good idea of where you're at so you know what you can do to be healthy.
Yeah. That's a great point. I mean, even if you don't want to go in to see your doctor, like go get a blood pressure cuff at a local pharmacy and just start there and take it a couple times a day. Take it first thing in the morning when you wake up, and then take it another time later in the day, like late afternoon, early evening, and just see what those numbers look like on a consistent basis. And, if you're getting in that 130 over 80 or above those numbers, you really need to start watching it more closly. And because there are different
magic number.
Yeah, 130 over 80 is kind of the newer numbers now, where we can tolerate a little bit higher numbers for the systolic, which is the top number, but it's the diastolic number that our bodies just can't tolerate a higher pressure, because that's the pressure in your arteries when your heart is relaxed in between beats. So if it's higher, we can do more sustained damage. So it's just like, watch those numbers. And if you're consistently above that, then, you need to get checked out. And but monitoring at home is a great first, step. And then, if your numbers are kind of borderline there, play around with it. Start changing your diet, exercise more, make sure you're getting good sleep, all the stuff we're going to kind of talk through today, and then see if those numbers change at all. If you're doing a lot of work and effort and you don't see those numbers change, that's a big deal. Like, you really need to get in and get it further evaluated, which I know a lot of guys don't want to do. But, this idea that we have to be tough and just kind of grin and bear it and take it on. I mean, we got to get past that, because you're no use to anyone if you're dead. So, if you think you're doing this for your family and your kids, and you got to provide and you got to work and that sort of thing, well, what's going to happen when you're gone? It's like, we just got to get over that.
Yeah, what you don't want on your gravestone if you die at 48 was, I was tough.
Right.
I toughed it out.
Yeah, exactly.
Instead, like, get help now. Make it to your 70s, 80s. Spend some time with your grandkids or kids or loved ones or your pets or whoever you like.
Yeah, absolutely. And it's like, at the end of it all too, like, how much of it are you going to say, like, on your deathbed, like, man, I wish I would have worked, 80 hours a week instead of, 60 hours a week. And, it's just like, at the end of it all, like, how much does it really matter?
That's a good point. And we kind of jumped ahead a little bit, but you mentioned it some when we were talking there. As far as cardiovascular health, like, what kind of things in your life affect blood pressure, affect cardiovascular health? Like, what activities are really going to be affecting that?
Yeah. Well, it's everything, right? It's everything we always talk about every week. And it's a lot of different variables. So it's your diet, the junk that you're eating. It's, your lack of exercise. It's your poor sleep. It's all the environmental toxins and junk that we're exposed to on a daily basis that increases oxidative stress and inflammation and all that kind of stuff. It's smoking, it's poor air quality. All those things are going to contribute to that stress on our system, which is largely going to play out as cardiovascular damage.